Difference between ephedrine and pseudoephedrine. Ephedrine and pseudoephedrine are two related compounds that are commonly used in medications and supplements, primarily for their decongestant and bronchodilator properties. Despite their similar names and functions, these substances have distinct differences in their chemical structures, uses, and regulations. We will explore the key differences between ephedrine and pseudoephedrine. Chemical structure. Ephedrine. Ephedrine is a naturally occurring alkaloid found in plants of the ephedra genus, such as Ephedra sinica, also known as ma huang. Chemically, it is an organic compound classified as a sympathomimetic amine. It is structurally similar to methamphetamine, a potent stimulant. Pseudoephedrine. Pseudoephedrine is a synthetic compound, often produced from ephedrine. While it shares a similar chemical backbone with ephedrine, it has a specific configuration that makes it distinct. Pseudoephedrine is also classified as a sympathomimetic amine and is commonly used as a nasal decongestant. Medical uses. Ephedrine. Ephedrine has a longer history of use in traditional medicine and was commonly used to treat asthma, nasal congestion, and other respiratory conditions. However, its use has declined due to safety concerns and the availability of alternative treatments. Pseudoephedrine. Pseudoephedrine is primarily used as a nasal decongestant to relieve symptoms of the common cold, allergies, and sinus congestion. It works by constricting blood vessels in the nasal passages, reducing swelling and congestion. Regulation and control. Ephedrine. Ephedrine is subject to strict regulations in many countries due to its stimulant properties and potential for abuse. In some regions, it is classified as a controlled substance or available only by prescription. Pseudoephedrine. Pseudoephedrine is also regulated, primarily because it can be chemically converted into methamphetamine, an illegal and highly addictive stimulant. In many places, pseudoephedrine-containing products are sold behind the pharmacy counter, and purchasers may be required to provide identification and have their purchases logged to prevent excessive buying. Safety concerns. Ephedrine. Ephedrine has been associated with numerous health risks, including increased blood pressure, heart palpitations, and even severe cardiovascular events in some cases. Due to these safety concerns, its use in over-the-counter medications has been restricted or banned in several countries. Pseudoephedrine. Pseudoephedrine is generally considered safer than ephedrine when used as directed. However, it can still cause side effects like increased heart rate and blood pressure. The risk of abuse and illicit drug production is a significant concern associated with pseudoephedrine. Availability. Ephedrine. Ephedrine-containing products are less common in over-the-counter medications today due to safety concerns and regulatory restrictions. They may still be available in some herbal supplements. Pseudoephedrine. Pseudoephedrine is more widely available in over-the-counter cold and allergy medications, although regulations vary by region. Purchasers typically need to request it from a pharmacist and may be subject to purchase limits. Conclusion. While ephedrine and pseudoephedrine share similarities in their chemical structures and uses as decongestants, they differ in their sources, regulations, safety profiles, and availability. It's essential for individuals to use these substances responsibly and as directed by healthcare professionals to avoid potential health risks and legal issues. Additionally, regulatory measures are in place to prevent the misuse of these compounds for illegal drug production, particularly in the case of pseudoephedrine. Always consult with a healthcare provider before using any medication or supplement containing ephedrine or pseudoephedrine to ensure safe and appropriate usage.